In today's video, we will unveil 12 silent signs your heart could be in danger. We confront a stark reality. Every 36 seconds, heart disease claims a life, establishing itself as the leading cause of death worldwide. This silent killer often strikes without the expected dramatic symptoms, making early detection challenging yet crucial. We will explore the subtle yet significant indicators of heart disease, which are often overlooked or misunderstood. Understanding the nuances of this silent threat is more than just health awareness. It's a potential lifesaver. Before we dive deeper, if you find our content valuable, please show your support by hitting the like button. Also, don't forget to subscribe and turn on notifications so you never miss out on life-saving information. Stay with us until the end of the video for 2 amazing gifts we've prepared just for you. These exclusive bonuses are designed to further enhance your journey towards better heart health. Trust us, you won't want to miss these special surprises. So, sit tight, keep watching, and let's embark on this informative journey together. At number 12, we address depression, a condition far beyond a mere state of mind. It's a significant heart health indicator. The intricate link between heart disease and depression has been consistently supported by research. Studies show that individuals suffering from depression are 64% more likely to develop coronary artery disease. But the connection goes deeper. The American Heart Association highlights that depression is not only prevalent among heart disease patients, but it can also amplify the severity of heart conditions. Depression triggers biochemical changes, like elevated levels of stress hormones, such as cortisol, which can exert considerable strain on the cardiovascular system. This strain can lead to arterial damage, increasing the risk of heart attack and stroke. Furthermore, depressive states can affect lifestyle choices, leading to poor diet, physical inactivity, and smoking, all known risk factors for heart disease. The psychological burden of depression can also affect adherence to heart medication regimes, exacerbating existing heart conditions. Thus, recognizing and effectively managing depression is essential, not just for mental well-being, but also for heart health. This dual approach can play a crucial role in preventing the onset of heart disease or in managing existing conditions more effectively. Entering our 11th spot is unexplained fatigue. This isn't your usual tiredness after a long day. It's a relentless exhaustion that doesn't improve with rest. The American Heart Association highlights that 70% of women report experiencing this type of fatigue in the weeks leading up to a heart attack. This symptom is particularly insidious because it's easily dismissed as a byproduct of a busy lifestyle. However, it can indicate that the heart is struggling to pump blood effectively, depriving organs and tissues of essential oxygen and nutrients. Chronic fatigue, especially when accompanied by other symptoms like shortness of breath or chest discomfort, should prompt an immediate medical evaluation. At number 10 are anxiety and heart palpitations. While often associated with stress, these symptoms can also be early signs of heart disease. Research has found that individuals with high levels of anxiety are up to 26% more likely to develop heart disease. Heart palpitations, characterized by an irregular heartbeat, can indicate arrhythmias. These arrhythmias, if left untreated, can lead to more severe conditions, including atrial fibrillation. Atrial fibrillation is particularly concerning as it increases the risk of stroke by 5 times compared to the general population. These symptoms should not be overlooked, as timely detection and management can significantly reduce the risk of severe heart complications. Number 9 reveals sleep apnea, a condition that is much more than a snoring issue. It has profound implications for heart health. A landmark study in the American Journal of Respiratory and Critical Care Medicine reveals that individuals with severe obstructive sleep apnea face a 30% higher risk of heart failure compared to those without the condition. But what makes sleep apnea so dangerous for the heart? It's characterized by repeated interruptions in breathing during sleep. Each interruption, or apnea, momentarily cuts off the oxygen supply, causing fluctuating oxygen levels and immense stress on the heart. These frequent oxygen dips can lead to a surge in blood pressure and overall cardiovascular strain, significantly increasing the risk of heart conditions such as atrial fibrillation, heart attacks, and even stroke. Notably, sleep apnea is often underdiagnosed, as many are unaware that their disrupted sleep patterns could be a sign of this condition. It's also linked to obesity, a major risk factor for heart disease. Treating sleep apnea, often through the use of continuous positive airway pressure machines, not only enhances sleep quality but also plays a pivotal role in reducing the risk of developing heart conditions. By addressing sleep apnea, patients can mitigate its adverse effects on heart health and significantly improve their overall well-being. At number 8, we encounter random cold sweats, a symptom that may seem trivial but could be a vital warning sign of heart issues. Known medically as diaphoresis, these cold sweats are a form of excessive sweating that occurs without the usual triggers like physical exertion or high temperatures. Research indicates that among patients who experience a myocardial infarction, commonly known as a heart attack, approximately 15% report experiencing cold sweats as a precursor symptom. When the heart encounters difficulty in pumping blood efficiently, it triggers the body's stress response. This response can activate the sweat glands, leading to sudden and unexplained cold sweats. It's the body's way of signaling that something is amiss. Moreover, cold sweats are often seen in conjunction with other alarming symptoms of heart problems, such as chest pain, shortness of breath, or a feeling of impending doom. These combined symptoms can indicate a heart attack or other cardiac emergencies. A study in the Journal of the American Medical Association found that patients experiencing cold sweats along with other symptoms were more likely to be experiencing a serious cardiac event. Seeking immediate medical attention in such scenarios can be life-saving, as early intervention is key in treating heart-related emergencies. From random cold sweats, let us proceed to a sign that can be equally unsettling. Number 7 on our list is dizziness or lightheadedness. Often brushed off as mere fatigue or dehydration, these symptoms can indicate a more serious underlying issue, particularly when they occur frequently or are accompanied by nausea or fainting. Dizziness and lightheadedness can result from reduced blood flow to the brain, a condition that may stem from irregular heart rhythms or compromised heart function. They're especially concerning if they happen during physical activities or suddenly change positions. Regular occurrences of these symptoms warrant a thorough cardiovascular evaluation to rule out potential heart problems. Number 6 brings us to leg pain or cramping, often a sign of peripheral artery disease or PAD. PAD is caused by narrowed arteries in the legs due to plaque buildup, a condition closely related to heart health. The American Heart Association reports that over 8.5 million Americans have PAD, many of whom experience symptoms like leg pain, cramping, or heaviness, especially during physical activities. These symptoms are due to insufficient blood flow to the muscles. It's a critical sign because PAD is often a marker of widespread atherosclerosis, affecting not just the legs but also the arteries supplying the heart and brain. This increases the risk of heart attacks and strokes. Regular checkups and lifestyle modifications are key to managing PAD and preventing serious heart conditions. Coming in at number 5 is an upset stomach. Surprisingly, gastrointestinal distress can be a subtle sign of heart trouble. A study published in the Journal of the American Medical Association found that about 1 in 5 heart attack victims experienced abdominal pain as a symptom. The heart and stomach are connected by shared nerve pathways. When the heart is in distress, it can send pain signals to the stomach. This can manifest as nausea, indigestion, or a full feeling in the upper abdomen. These symptoms are particularly noteworthy when accompanied by chest discomfort or shortness of breath. It's important not to dismiss recurrent stomach issues, as they could be a sign of underlying heart disease. At number 4, we have a persistent cough, a symptom often misattributed solely to respiratory issues, but can indeed signal heart disease. In cases of heart failure, a condition affecting approximately 6.2 million adults in the United States, the heart struggles to pump blood efficiently. This inefficiency can lead to fluid accumulation in the lungs, a condition known as pulmonary edema. A key indicator of this is a cough that produces a distinctive white or pink-tinged mucus, indicative of blood mixed with the fluid. This specific symptom of heart failure is critical to recognize. Studies suggest that up to 50% of patients with left-sided heart failure experience this type of cough. beyond just the production of colored mucus. A persistent cough and heart failure patients can also be accompanied by other alarming symptoms like wheezing, breathlessness, and a feeling of being unable to draw full breath. It is particularly prevalent in the evenings or while lying flat, which can disrupt sleep and exacerbate fatigue, a common issue in heart failure patients. It's evident that a persistent cough is not a symptom to be overlooked, especially for individuals with known heart disease risk factors or existing cardiovascular conditions. Recognizing and addressing this sign early can be pivotal in managing heart failure and improving overall heart health. But what could be the #1 silent sign that your heart is in danger? According to the American Heart Association, a seemingly unrelated symptom is experienced by up to 30% of heart attack patients. Yet, it's frequently overlooked or misattributed to less serious health issues. What could this symptom be? Why is it so commonly dismissed? And how can recognizing it save lives? Stay with us, as we're about to unveil the top sign that your heart could be at risk. For now, at number 3, shortness of breath, a symptom often underestimated in its severity. The American College of Cardiology notes that up to 40% of heart failure patients experience this symptom. It's particularly concerning because it indicates a possible inefficiency in the heart's pumping action, leading to fluid accumulation in the lungs, medically termed as pulmonary edema. This can manifest as difficulty breathing during routine activities or even at rest, significantly impacting daily life. A pivotal study in the New England Journal of Medicine highlighted that shortness of breath could precede a heart attack by as much as 6 months. Furthermore, research shows that this symptom is not limited to older adults. Younger individuals with latent heart issues can also experience it. Prompt attention to changes in breathing patterns, particularly if accompanied by symptoms like fatigue or chest discomfort, is crucial. It's a clear indicator that the heart might be struggling and warrants immediate medical evaluation. Securing the second spot are swollen ankles or feet, a symptom that is often dismissed as trivial but can be a sign of underlying heart issues. According to the Journal of the American Heart Association, approximately 22% of heart disease patients present with peripheral edema. This swelling is typically a consequence of the heart's reduced efficiency in pumping blood, leading to fluid retention in the lower extremities. It's also important to consider that such swelling can be a side effect of certain heart medications, complicating the diagnosis. Persistent or worsening swelling, especially when accompanied by weight gain or abdominal bloating, is a sign of concern. In some cases, it could indicate right-sided heart failure, where the heart struggles to pump blood into the lungs, causing fluid to back up in the body. Regular monitoring of these symptoms, along with professional medical advice, is essential for those with known heart conditions or risk factors. And now, at the top silent sign your heart could be in danger, is left shoulder pain, a symptom deceptively simple yet critically important. According to the American Heart Association, up to 30% of heart attack patients experience this pain, yet it's frequently overlooked. The reason for its significance lies in the heart's anatomy and nerve pathways. During a heart attack, pain is often referred to the left shoulder due to the heart's proximity to the phrenic nerve, which runs near the left shoulder. This neurological phenomenon can cause pain signals from the heart to be felt in the shoulder area. Intriguingly, a comprehensive study involving over 2,000 heart attack patients published in the Journal of Pain Research found that referred shoulder pain was one of the most common misdiagnosed symptoms, leading to delayed treatment. This delay can be detrimental, as statistics from the American College of Cardiology suggest that the survival rate of a heart attack patient decreases by 7 to 10% for every minute treatment is delayed. Furthermore, research indicates that individuals who experience left shoulder pain during a heart attack are less likely to recognize it as a heart-related issue, often attributing it to muscle strain or arthritis. This misinterpretation can lead to a critical delay in seeking emergency medical care. The symptom is particularly misleading because it can occur without the classic symptoms of a heart attack, such as chest pain or shortness of breath. Recognizing left shoulder pain, especially when it's sudden, unexplained, and severe, as a potential sign of a heart attack, is of utmost importance. Given the high stakes and the prevalent underestimation of this symptom, It's crucial for both the public and healthcare professionals to be aware of its significance as a potential indicator of a cardiac event. As we conclude our journey through the 12 silent signs your heart could be in danger, it's clear that our bodies often communicate in subtle yet significant ways. Recognizing these signs is not just about being cautious, it's about being proactive in safeguarding our heart health. Each sign we've discussed today is a piece of the larger puzzle of understanding heart disease, the world's leading killer. Remember, the key to combating heart disease lies not only in recognition, but also in timely action and lifestyle changes. Stay informed, stay vigilant, and always prioritize your heart health. Thank you for joining us in today's video. If this video has provided you with valuable insights, please show your support by liking and subscribing to our channel. Don't forget to leave your thoughts and questions in the comments below. We love hearing from you and learning about your experiences. And as promised, we have 2 amazing gifts waiting for you. Check out the description box below to access them. Your heart health is a journey worth investing in, and these gifts are our way of supporting you on that path. Until next time, stay healthy,